I am a geriatric care manager. I work for Kim Boyer, who's a certified elder law attorney, and I do marketing and outreach and kind of keep in tune with what's going on in the healthcare community regarding seniors and patients and consumers in general. Most specifically, we help people with estate planning, guardianship, Medicaid planning, veterans planning. So we will work with people to be proactive and plan to preserve assets, prevent crisis, and then in the event of crisis, we do step in, we prevent exploitation, abuse and neglect, things of that nature. As a geriatric care manager, one of the things that I do is keep in tune with all of the services in the community so I can advocate for patients and clients and guide them in the right direction based on their predicament and their situation. I also stay involved with a variety of different organizations. I'm the president of SNCA, which is Southern Nevada Continuity of Care Association. And what we do is ongoing education for professionals to keep in tune with new services, new innovations. I'm involved with ASDO, Aging Services Directors Organization. So I try to keep in tune with organizations like that, as well as with nursing homes, assisted livings, hospitals, docs, psychiatrists, inpatient psych hospitals, you name it. We try to keep in tune with everything that's going on in the community. Well, Universal Solutions has the same approach in pre-planning. Being proactive about your life and your health, and so do we. And that, like I said, we receive I'd say about 90% of our phone calls are families in crisis. They're in a situation that is scary and frightening for families, and they need help immediately in getting out of this jam that they're in. Whereas if they did their planning ahead of time, their estate planning, or planned ahead for a nursing home stay, or veterans planning, they wouldn't be in the crisis that they're in. Universal Solutions is similar in that patients may receive all of these medical bills, and they've been receiving them for a period of time, not knowing that they're spending more money than is necessary because they didn't have a professional view their bills and advocate on their behalf, because the terminology on some of these medical bills is very complex. The average consumer cannot understand what they mean and what they're being charged for. And they truly need, based on the healthcare system that we have in the United States, they need an advocate who can help them understand what their bills mean and what their rights are. And Universal Solutions is really an advocacy services for all consumers, including seniors. Well, Chris and Ryan are very, very good at what they do and have a tremendous background in the medical billing. So they are truly the experts in the field, and that's what we need in advocacy and any advocacy solution. You need to see the expert. If you're going to see an attorney for guardianship, you're going to see a certified elder law attorney who really understands the law, the rules, the regulations, who understands Medicaid, what you need to do to get approved and so forth. And Universal Solutions is that solution, in that the guys running this team understand medical billing better than any other advocate out there. So, absolutely anyone can use this service. It doesn't matter if you have health problems, if you're extremely healthy. It's a fantastic service for any consumer out there. The senior community is a perfect community for this type of service, because seniors, more than other populations, frequently see doctors, and not just one doctor, but several doctors. They see a primary care physician, they have specialists, they may go to the hospital, so there's a variety of different medical offices that they're going to for services, and therefore receiving a variety of different bills. So, and prescriptions as well. The average senior in the United States today takes 13 prescription medications every single day. And the average senior is not familiar with bills. The average consumer is not familiar with bills, let alone seniors who may have other things going on. And so this is absolutely a perfect service for any senior who wants to be proactive and wants an advocate, to make sure that they're not being cheated, and to make sure that their rights are being addressed and that their bills are fair. Service that can work as kind of a treatment team with other services and can work with the family to prevent crisis. And also, you know, again, it doesn't have to be the seniors that are receiving the services or that are, you know, your clients. Their adult children should as well. And as we probably are well aware, the caregivers are frequently the ones that experience burnout and also need to see doctors and to make sure that their health is being monitored properly. So it really can help them in their health as well as their folks.